Great. Well, good afternoon, everyone. Thank you all for joining us today, both people in person here in New York and those watching via live stream. Welcome to this important convening on the margins of the 69th UN Commission on the Status of Women. This year marks the 30th anniversary of the Fourth World Conference on Women and adoption of the Beijing Declaration and Platform for Action in 1995. It is also now 10 years since the 2030 Agenda for Sustainable Development and its Sustainable Development Goals. My name is Tewodros, and I'm with the Global Center of Health Diplomacy and Inclusion, or Cehdi. We've organized today's first session along with Citizen News, the Women's Global Network for Reproductive Rights, and the Sexual Health and Rights Initiative. I will be co-moderating the following panel with Dr. T here, where we will be welcoming this brilliant group of SRHI experts and advocates to share their perspectives. So it is clear, very clear, that the world is not on track to deliver on Sustainable Development Goal 5, which promises gender equality by 2030, where no one is left behind. And whatever progress has happened towards this goal and the Beijing Declaration of 1995 is threatened by the global anti-rights push that we are seeing today. So the regressive Geneva Consensus Declaration, the Madrid Commitment, and the gag rule or Mexico City policy are only a few examples of this violent curtailment of rights and bodily autonomy that we are seeing. And a lot of the language surrounding this moment we're in with the Beijing Plus 30 and the SCG review relies on stock taking and review. And of course, reflection will always be important and necessary, but our conversations cannot and will not end there. So I think it is necessary for us to communicate the urgency that we must act with in order to protect bodily autonomy and ensure that gender inequity ends with us. So after a brief opening, we'll request our panel of experts to make introductory remarks, and then we'll open up the room for discussion. So without any further ado, let me welcome Dr. Haileyesus Getahun for some opening remarks. Dr. Getahun is Chief Executive Officer of Cehdi, a Geneva-based NGO working to drive sustainable and collaborative change for the right to health and global health equity. And Dr. Getahun served in the WHO headquarters for over 20 years and also served as the founding director of Quadripartite Joint Secretariat on AMR. So thank you, Haile.
Thank you, Biruk, and welcome, and thank you for coming. And this is an important session because we are at the crossroad. The assault on global health and the assault on the right to health is more than any other time. And this is a time that we need to unite. We need to find, solid ground to bring our voices and listen and make sure that everyone has the right to health, regardless of gender, regardless of sexuality, or where they are born. That is why the Global Center for Health Diplomacy and Inclusion was established in Geneva, basically to raise the voice of the Global South in global health negotiations. As you know, most global health negotiations are happening in Geneva. And the existing multilateral system didn't address the need of the Global South during the COVID pandemic. And we are still living with those tragic lessons of the COVID pandemic, where the Global South was neglected, was not benefiting from the health benefits that happened during the pandemic. So that is why, if at all there is another pandemic, at least for our kids or for their kids, that we need to make sure that what happened during COVID will not be repeated. So that is why we are working to enhance South-South partnership, to enhance like-minded multilateralism between North to South partnership by bringing governments to be the sole responsibles of the right to health, that the health is a right for every citizen that the government should take lead. And of all those, the right to sexual and reproductive health and rights is the corner and the founding for everyone and for us. So that's why we are here today, and we look forward to listen to you and then find a way to solidify and to strengthen our voice so that we resist the assault that is happening now on global health. So thank you very much.
Thank you, Hele. So now we'll welcome Dr. Tlaleng Mofokeng, the UN Special Rapporteur on the Right to Health, for her opening remarks. Thank you.
I have to use this for the people online, I think. Great. Good morning, everyone. And I'd like to firstly say good morning to our ambassador to the United Nations of South Africa, Ambassador Matu Joyini. Thank you very much for joining us this morning, and all of the delegates who are coming from the different organizations, and of course important UN agencies that have been key in the delivery of the right to health in many countries and many contexts around the world. And the question is, are we on track to actually realize the right to health and for gender equality? And as the current mandate holder in this current position and mandate, I can tell you that no, we are not on track, but none of you are not surprised, because you know, even with the 2030 agenda that we all set for ourselves as the common vision and a common work plan, that we are not doing well. So we cannot be surprised, but I think the question is then what are we going to do about it? And the recent events in the world have really made my initial approach to this mandate of one being anti-racist and anti-colonial very, very important. And I no longer have to argue why that was important to use those frameworks when it comes to the right to health. In 2020, when I was appointed as a mandate holder, I had to defend that, but I don't think I have to anymore, which is unfortunate because it means violations of human rights have happened to a degree that people now get it, right? And human rights being an early warning system, I had hoped and wished that that work would have been able to be taken on, even by member states themselves, in how they approach, firstly, the pandemic, but also subsequent crises that are now grappling the world. Protracted war, genocide, various humanitarian settings because of the climate crisis, all of them impacting different people disproportionately. And we know on the basis of sexual orientation, gender identity, age, where you are born, there are many other various grounds of discrimination. We know that discrimination continues, and that's why human rights is something that unites all of us and not divides us. And we should resist and really push back harder on the idea that human rights is divisive. Human rights are the actual basis of how we can move forward with something in common as humans. And just to say that the work requires a constant analysis of power. None of us can come into this work or even imagine a world, a future world that is just, without a commitment to constantly analyzing power, how it moves and shifts through us as individuals, as it moves and shifts through our own organizations, but also at the multilateral system. And so it's important to understand vulnerability as a human right. Everyone has a right to be vulnerable. There are moments in life where any of us could find ourselves as a refugee for any reason. And that's why we should be concerned about the rights of refugees, whether or not you think you are a refugee. That's why we should all of us concern ourselves with the rights of women and young girls who need contraception, for example, or people who use drugs, who need support, housing, education, nutrition, and the like. So the idea that you can dislocate the right to health from other human rights it's impossible. And it's also good to remember that when you realize the right to health, you enable many other human rights, and therefore you can actually get to gender equality. And with that, I would like to hand back over to Biruk, who will then take over the session with our panelists. And we look forward to listening to all of you coming to this panel with amazing experience, and it feels like we are a reunion of sorts, yeah? We've worked many times online with many of you over the years, and I think it's important as we pour back into each other's cup to recognize how tired we all are. And I hope that today can be that moment where we can all just stop and just take a deep breath and just re-pour back into each other's cups as we re-strategize. And the work only starts with this conversation, but it actually continues way after this has been done. So well done to you, Biruk, for bringing us together this morning. Thank you very much. And I'm gonna go back and sit there.
Thank you so much for that. I do want to echo what you said about human rights not being divisive, and the only way forward that we have offers a framework. And I'm very grateful for all of the requests. Ms. Dawn Minott from the UNFPA, Senior Advisor on Gender-Based Violence at the UNFPA, to share your perspective and remarks.
Thank you, Biruk. Do we talk from here or should we come to the podium?
If you could.
Good afternoon, everyone. Good afternoon. There you go. You're in the room. And for those of you who are online, that would be good afternoon or good morning or good evening, wherever you are in the world. Thank you for joining us. I want to start off by saying I greet you in hope. I think this time more than any time, we need to be hopeful, not just in ourselves as human beings and the capacity that we have to what I call bounce back ability, to be able to bounce back, but to be hopeful in the sense that we have put in place mechanisms and structures and policies and programs to tide us through difficult times. And I dare say that these might be some of the most difficult times that we've seen in recent history. So I'm Dawn Minott, the Gender Advisor at UNFPA, and it's my pleasure to be here to speak with you and to have this conversation. I think in many ways we're united by our commitment to health, our commitment to rights, or our commitment to equality, to gender equality. And so I just want to extend a special thanks, Your Excellency, of course, Dr. T, and to the organizers for inviting UNFPA to be here, and of course to be on this panel with these illustrious speakers to bring this conversation to you today. So I think before we can look forward to answer the question that is before us today, it's really to take a quick look back. 30 years ago, the ICPD Program of Action and the Beijing Platform for Action did something remarkable, and that is it placed gender equality and women's empowerment at the heart of development. These conferences established that a woman's control over her fertility is fundamental to all of her rights. The vision that also drives the 2030 agenda and the call for universal sexual reproductive health and rights, which is central to achieving SDG 5 on gender equality and SDG 3 on health and well-being. Access to sexual reproductive health empowers women and girls, leading to improved health, economic opportunities, and stronger agency. So I think it's important for us to celebrate the wins as a start, because we have made strides, and I'll just highlight a couple of those. So globally, maternal mortality has fallen by 34%, and this is in the past 30 years. Modern contraception use has doubled, and as a result, this has reduced the unintended pregnancy in adolescent girls. There's also a recognition of gender-based violence, and that's increased to the extent that there are 162 countries that have enacted laws against domestic violence. And perhaps I think the most significant step forward has been on SDG indicator 5.6.1. And this indicator actually measures a woman's ability to make her own decisions about her sexual and reproductive health. Initial analysis suggests that over half of married or in-union women are now in the driver's seat when it comes to these fundamental aspects of their lives. 56% means that 44% of partnered women cannot make these essential decisions about their own health care, about contraceptives, or about their sexual decisions. So I also want to just highlight some of the other challenges that we see in the space in terms of delivering on gender equality and human rights to health. And these include the fact that maternal deaths have plateaued, and inequalities in access to SRH services also persist. We know that gender-based violence remains rampant. We've got 1 in 5 girls that are married before they're 18. And a woman dies every 2 minutes due to pregnancy or childbirth. And in this day and age, a woman should not die giving life. But these are the statistics that we're up against. Maternal mortality decline has stagnated, even increasing in some regions. And I think when we bring in the race and geography, then we see that these are really stark determinants in this conversation, because women in sub-Saharan Africa are 130 times more likely to die from pregnancy or childbirth than women in Europe or North America. And when we look at the Americas, Afro-descendant women and girls face higher rates of obstetric mistreatment, contributing to significantly worse maternal health outcomes. So these inequalities sadly extend also to gender-based violence. And when you break that down by age, sexuality, race, and ethnicity, these all play a role to the extent to which women and girls are experiencing violence that is impacted or imposed upon them by virtue of their gender. So in answering the guiding question of today's discussion, are we on track? Dr. T already gave us the answer to that, but I think we all know this. So I want to recall a recent report that came out from UNFPA, which highlighted what I'd say is a very concerning trend, because the progress that we've seen or that we've made has largely benefited those who are already close to accessing SRH programs and services, which means then that the gap in terms of inequality to access is greater if we're reaching those who are already closer to service. So this is why we need to move away from a one-size-fits-all approach and really focus on reaching those who are furthest behind. Now that sounds like a catch-all phrase. We hear it all the time. Reach those who are furthest behind, which means you need to know who it is that is left behind and how far behind they are being left. So important to that then is having data. So the truly being able to advance SRHR, sexual reproductive health and rights, we need to have national data systems that have the ability to give us that clear picture of the who is being left behind. This means we need to make the investment in collecting data, but not just collecting data, data that's disaggregated by age, by ethnicity, by race, by disability status, by sexual orientation, and also to be able to analyze that data. What is the data telling us, and how do we use this analysis to inform our programs and our services? So looking ahead, we're facing some significant global shifts. I mean, we're facing them right now. We're living in the moment. And all of these are impacting sexual reproductive health and reproductive rights. We're seeing rapid demographic changes, which are unfortunately leading to increased population anxieties and policies aimed at controlling fertility rates. These approaches often undermine fundamental human rights and disproportionately target women's bodies. We need a fundamental shift, and this shift in focus is away from controlling fertility and towards empowering individuals and respecting their reproductive rights. Dr. T talked about the humanitarian crisis that the world is facing. That's also a major threat. It's critical for us to integrate SRH and GBV prevention and response into all phases of humanitarian response. And I say all phases, particularly at the onset of a humanitarian response. It's critical that SRH services and gender-based violence services be considered as essential, right up there with food and water. So we are at the early stages of the 5th industrial revolution. So we see there's more human-centric AI. There are advances in biotech. There's augmented reality. Yet the digital gender divide has prevented many women and girls from taking advantage of even the fourth industrial revolution. So I think in many ways this presents both opportunities and challenges for our work in the SRHR space. For instance, we know that new technologies can expand access to contraception and help address infertility. That's one opportunity. But we have to also be vigilant about the risk around mis- and disinformation that's very well populated online, as well as the rapidly increasing technology-facilitated gender-based violence. So the more time that women and girls spend online to access services that become more accessible because of this industrial revolution that we're in, the greater their risk to violence that is facilitated by being online. We're also missing a growing concerning resistance on efforts to push forward human rights and gender equality. I was in a session with Kemi earlier this week, last week? There have been so many. And I said to that audience, I don't want to say push back anymore. I want to talk about push forward. And I think the more we put our energy and our efforts into designing and defining what a push forward strategy looks like, the less power we give to the pushback. So in that context, what's happening in the world around us is not happening in isolation. It's transnational, and it's trying to roll back progress on bodily autonomy, on SRHR, on comprehensive sexuality education, and protection from violence. But this is where I see hope. And I started off by greeting you in hope, because I think the more that we spend time in the what's not working well, the less hopeful we are. But a lot is working well. I think of the Indigenous women who are leading the charge for environmental justice and recognizing its deep connection to reproductive health and autonomy. And what that says to us is the power of cross movements. The silo approach never worked, and it definitely will not work in this time. So how do we work across movements? How about the young activists who are passionately campaigning for climate justice, linking it directly to reproductive justice? So we need to amplify these voices and recognize that sexual and reproductive justice is fundamentally intertwined with the broader fight for social justice. So as I'm coming to the end and thinking about our future, I think achieving SRHR and gender equality requires broad alliances, and I've made reference to a couple of those cross-movement opportunities, but also around resisting polarization, that the health system needs to be held accountable, and upholding bodily autonomy and advancing sexual reproductive justice. This demands a fundamental shift in resourcing SRHR. We need to put our monies in the places where the needs are greatest. Investing in SRHR is a powerful driver of progress. I'll give you an estimation from UNFPA, work that we've done, give us the information that if we have, if UNFPA estimates an $8.40 return for every dollar that's invested in family planning and maternal health in developing countries. $8.40 is the return on that investment. I think if we look at that over a number of countries and the amount of investments made in other areas, this investment would be worthwhile making. However, what we see in current health finance is inadequate. In 2022, less than 1% of global aid went to stopping GBV, and only 1% of health research focused on non-oncology female-specific conditions, and feminist groups average a mere $20,000 annually. And when you break that down into groups that are led by women of color, that number is even more desperate. So we must prioritize SRHR in health budgets, explore innovative financing, and direct more resources to women-led and feminist organizations. So I want to conclude with what I think is a call to action for all of us in this room, in the online space, starting off with financing. I think it's important for us to significantly increase international financing for sexual reproductive health and rights, for gender equality, and women's empowerment. There's a UN study, and my colleagues who are here from UNFPA will know that I more oftentimes than not will cite this study because it makes me cringe. It will take us 300 years to get to gender equality at the pace at which we are progressing. And I don't know about you, but that just does not sit well with me. So the investments are required to help us to advance more quickly. We need to use national budget processes for full SRH program implementation, including gender budgeting, and develop innovative financing and partner with women-led and feminist movements. I want to give an example from Panama. Again, UNFPA did a study on adolescent pregnancy and found that it would be around $525 million US per year. And when we looked at that in the context of the economy of Panama, we made the link to shutting down the Panama Canal for about 3 months. That's what $525 million will do. When this information was presented to the government, it was an aha moment. Because oftentimes when we're talking about women's issues, it doesn't land very well. But when you link that to dollars and cents, that's when we made the connection. In Panama, these numbers persuaded the government to implement policies that would expand access to contraception. So the more that we can provide the evidence, the more that we're speaking to the right parts of government. I'm with UNFPA, more oftentimes than not, we're speaking with the Ministry of Health and the women machineries. But more and more, we're knocking on the doors of the Ministers of Finance, because that's where it really matters, right? Where the rubber meets the road. The second, I think, is leveraging the power of arts and culture. Storytelling, music, the visual arts. As you're doing SRH advocacy, the way that we talk about policies and programs from the perspective of UNFPA as a UN agency, I don't think it lands in all the right spaces the way that we would like for it to land. But when you put this in a song or you write a poem, it gives us access, it connects. And what you're trying to do is to connect to people's heart. This is a battle, I think, for heart and soul. This is not so much about resources, because if you had all the money in the world, but people's hearts were not changed and their minds were not changed, and all that money will not make the difference that we're trying to make. So I think it's important for us to try to reach to the heart and souls of people. And then the final thing is around addressing barriers. And I think data, as I mentioned before, is important for that, and having that data disaggregated. So in addressing the barriers, it's important, I think, to ensure universal health coverage, fulfilling SRHR at all life stages, and strengthening health systems to meet international standards. Also important to strengthen support for women-led and feminist organizations. As a UN system, as UNFPA, we are committed to the strengthening of women's movements to be more autonomous and working directly with women organizations as partners in their own right. We have committed 35% of our humanitarian funding directly to local organizations, including women-led organizations. That, I think, is important for us to continue to do. So in conclusion, the journey towards SRHR for all continues. By working together with accountability, recommitment, and adequate resources, we can create a more just and equitable world. So I invite us to renew our commitment to make the promise of ICPD and the promise of Beijing a reality for every woman and girl in all of their diversity in every place that they occupy. Thank you.
For contextualizing this moment, I think it's very important to highlight our gains that we have made, but also the health disparity that we do see, and the importance of coalition building is very pertinent. So thank you for that. Next, we will have Dr. Roopa, an associate professor at Georgetown School of Medicine and co-founder of Women in Global Health. Thank you.
Hi, everyone. Can I get a loud hello back? Great. I am so excited to be here. I'm speaking in my personal capacity. I know 2 institutions were put out there, but it's Roopa today. There is so much I want to say, but I think I want to open first by acknowledging this is my first public engagement since I went through a pretty painful, rough exit. You can learn all about it online, but what I'm here to do is actually leave you with two key messages. And it's great because we're building on each other. And for me, one of the goals in this talk is to give you all hope, because I'm feeling hope. The second is hopefully inspire all of you to collaborate differently, one that is bold, inclusive, and unshakable. This is the room that is going to be the future, and it's rooms like this all around the world. As I was walking in the streets of New York, this is the first time I've been in New York, and I'm not going into the United Nations. Rapporteur, please excuse me. I was thinking to myself, nor do I have a desire, because I believe the real change is happening in communities all around the world, and local communities. And that's where we need to be supporting. And I will be talking about that a bit. I have written some remarks because there's a lot that I'd like to say, so bear with me, but let's be hopeful and let's collaborate. So are we on the right track on delivering gender equality and the human rights to health? No, it's been said. And if I was the AI plus me version in real time right now, my speech would have been edited down quickly because the speakers before have said a lot of these key messages. But I wanted to emphasize that, you know, the timeline we're talking about is that gender equality is going to at least take 100 years or 400 years. I mean, these are ridiculous numbers, right? These are numbers that are not going to be in our lifetimes. It's not even going to be in the lifetimes of 3 generations. So clearly what we've been doing, acknowledge the gains, hopeful, but we got to change it up and we got to accelerate change quickly. And unless we take the bold action in our lifetime, we may not even have a planet where women will ever have equality, because we know the planet is at risk. Since the 1995 Beijing Conference and Declaration, there's been undeniable progress. We've heard it. Girls are more educated, more informed, more determined than ever, but this progress is uneven. While some have gained rights, others are facing severe rollbacks. We're witnessing a gender apartheid in places like Afghanistan, which we would have never imagined. When I was a girl, and that was in the 1990s, in 1995, I was a young girl who never would have imagined we would have come back in the way that we are. We've prepared women for leadership, yet we have not created the enabling environments for them to lead and reshape the world on their own terms. We are all here today because we know we will not accept this fate. This room is here because we will not accept things as is. We want to achieve gender equality and women's rights in our lifetime. The real question before us is, are we willing to do things differently? I'm going to repeat that. Are we really willing to do things differently? Are we willing to adopt new tactics, work across differences and divisions, move beyond grievances, especially in the women's rights space and broader political arenas, to focus on a shared agenda? And are we really willing to shift power? You know, why I like this room is because it's a Global South-led room. I was born in India, Global South runs in my blood, but I see sisters here from all around the world. And that's what I mean about doing things differently. I was asked to talk about specifically global health. Are we reducing gender disparity in global health? Yes, we are. But fast enough? No, not at all. We know that progress is stagnant, under attack, even reversing. We've heard a lot of it today with gains and losses, but let's highlight a few key areas. On leadership, if you want data, there's lots of fantastic reports out there by Women in Global Health 50/50, and many other groups. But the big picture is women's leadership is stagnant. In COVID-19, we lost ground. The numbers dwindled down into single digits of representation in places like the World Health Organization Executive Board, which is a member state or government role. We are stuck at the 25% ceiling, maybe 30%. And it's estimated it's going to take us at least 100 years in global health, even though 70% of the global health workforce are women. Policy. While some policies have become gender sensitive and even gender responsive and transformative, backlash threatens to unravel all these. Universal health coverage for women remains far from a reality. Women bear the highest out-of-pocket healthcare costs and are more likely to forego care due to financial constraints. According to Women in Global Health, women contribute significantly to the health workforce, yet they face systemic inequities in pay, recognition, violence, and access to essential services. Women may be living longer, and yes, I hear that all the time. Look at women outlive boys, outlive men, what about them? But they're living poorer and sicker and carrying the entire burden of society on them. Ensuring universal health coverage that prioritizes women is not just a necessity, it's a fundamental human right. On health and rights, there have been some gains. I will skip the data because we have heard about it already, thanks to Don, especially on maternal mortality. We have gains, but these gains don't apply universally. We know how it affects Afro descent and Black women here in the United States specifically. We know access to sexually reproductive health has improved, but yet still women are lacking the ability to make decisions of their own bodies. Millions, and I would say actually billions, are lacking that. And the battle of bodily autonomy is here. It's the most contested fights of our time. While some countries have expanded to safe abortion and contraceptions, others are restricting them. Here in the United States, we're seeing the rollback state by state. It was a very hard-won battle to begin with, but we're seeing it here just in our neighborhoods. And this reinforces cycles of poverty and ill health. Yet there are other areas that are gaining new traction. Women's health and life course approach, especially acknowledging taboo issues such as menstrual health, infertility, menopause, endometriosis. We're excited in the women's health community about how much more traction we're getting. Then I want to shift focus to the impact of the anti-rights movement on global and national health. We've heard a bit about that, and I really like your language, not about pushing back, but pushing forward. Anti-rights movements are gaining strength, directly undermining women's rights and health policies. Their strategy is clear: divide and conquer, and we face a two-front attack. Now, these are things I haven't said before, but I think it's on point. Please let me know, give me feedback. I want to learn from all of you in this room. From the conservative right, rolling back reproductive rights, restricting healthcare access, reinforcing patriarchal structures. The Geneva Consensus, launched in 2020, seeks to limit women's participation primarily to the family, a dangerous regression. This coalition has grown, but it's still a minority. It's 20% of the world's population. And then we have an attack also from the parts of the liberal left, if you identify with that, the erasure of women's identities by replacing language about women's rights with impersonal terminology. Women are referred to as chest feeders, pregnant people, people with cervixes, language that diminishes their identity. We do not want to refer to men as people with prostates. This alienation has created fear, silencing of women from speaking up, and to be labeled as anti-rights. The quest of validation of intersectionality needs to be balanced, and we need to move forward together, not against. There is a price to the cancel culture, and the liberal left is losing women and men to the right, and we must acknowledge that head on. It's not just in the United States, it's all around the world. Why in the anti-rights movements growing? Well, despite being a minority view, the movements are fueled by a combination of economic instability, political opportunism, deep-seated gender norms, and then we have to acknowledge what post-COVID world did. It created inequalities, job insecurity, social instability, and people are lonely. I've been traveling the world for probably about 9 months, a lot of it for fun, not for work, and it's been great. I've been connecting with people in their local communities, from our Uber drivers to taxi drivers to those selling groceries, people at the bar, people at the coffee shop. And one commonality is people light up when you actually take a moment to look into their eyes and just say, hey, how are you? Tell me about yourself. What do you do for fun? These are conversations we've forgotten, and we're feeling the impact of that in our everyday lives. So the backlash is growing, but we can counter it, especially with men and boys perceiving their shifting roles as a loss of privilege and responding through misogyny. I'm a mother of a 3-year-old boy. Well, he technically turns 3 tomorrow, but I can call him 3. I'm worried about his future because, he's not going to have much space to be a male ally, to be a feminist. There are very few options, and we got to think about our boys and men, but not at the price of our girls and women. At the same time, it's already been discussed here, but these rights organizations are getting billions. We're talking in millions in global health, and, we got to get to billions and trillions, right? That's the kind of money we need to counter it, because billionaires are funding most of those billionaires are men, are funding a certain new type of vision for the world. And so we need funding to come in unrestricted ways to women's movements. Don, I agree with you. We gotta get them to women's movements that are working in local communities, especially in the global South. We've talked about restrictions on abortion and contraception. On the same page, we got to continue to push the legal and policy changes, but it begins in communities. These anti-right narratives are exploiting culture and religious sentiments. To my sisters in the global South, I'm conveying a message I've heard. Please challenge me on it if you don't agree. But in many of these countries where there are, women believing in this and men, the women's rights agenda is being pushed as a Western agenda rather than a fundamental human right. And we know that's not the case. So let's talk about how the voices from the global South are the real drivers of change, not just in the global South, but all around the world. And there's so much I want to say, and I'm going to fast forward because I'm mindful of time. We've had wins, but they're not secure. The real battles are being fought at the national and local level. We need to safeguard the process, and give resources to those fighting at the front line. A way forward is unity, not conformity. We don't need to agree on every detail. We need a shared commitment to advance the rights of women and girls. Our fights should never be against each other, especially in these times. Coalesce, don't fragment. The women's movement is diverse, and that is our strength. We don't need perfect agreements, but we need to commit to advancing a common agenda, a non-negotiable priority. We need to recognize the two-front attack. Patriarchy is the greatest weapon in division. We must reject the ways it comes up, whether it's identity politics, whether it's women being pit against women. We need to really work together. Grow the pie for all. I think there is this notion, especially when our ceiling is limited to 25% to 30%. I'm talking about health, but most of society will have a similar ceiling for women. It's not a zero-sum game. More power for women leads to stronger, prosperous societies, healthier communities, greater justice for all. In health, we call this the triple gender dividend. We must engage male allies, bring them along, especially those willing to be part of the solution. But let's not get held up by the men. They want to come along, great. If they don't, we'll still bring them along. Unconditional sisterhood. This one's particularly personal for me. We must support those who genuinely fight for women's rights. We must hold each other accountable while allowing space for learning and growth. Feminism, intersectionality, women's rights must be practiced, not just preached. At the same time, we must recognize that when women step up and lead courageously, they should not be torn down by those within our movements. We cannot afford to have internal conflicts that weaken our collective strength. Women who actively undermine or discredit other women's leadership must also be held accountable on their intentions. If we want to build a movement rooted in solidarity and respect, we must foster that culture. We have to be the role models. We can't be bystanders. Where leadership is celebrated, constructive criticism is encouraged, and personal growth is fostered. But personal grievances should not overshadow the bigger fight. It's time to get our house in order as women movements and become a united movement. Sustain the movement's leadership. A movement is only as strong as its leaders. We must remember to take care of our leaders. Think about the risks they're taking, legal, financial, security, life and death, not just for themselves. It's becoming dangerous for the women, especially at the front lines, who are providing contraception and abortion, family planning, even talking about a girl going to school. They are risking their life. We need to give resources and governments and donors and whoever's resourcing them for their protection, security, their mental health, their well-being. These are things that don't get funded in grants, so let's do it differently. Let's really support the leaders at our front line. The final thing I'll say is, I see this as a window of opportunity. I am someone that has always approached policy, and one terminology that stood out for my master's, and probably the only phrase for my public policy, is a window of opportunity. We can either look at the chaos as created right now as truly doomsday and the world is ending, or as we talk about a message of hope, we can see this as a window of opportunity, shaping a new global order that is, guess what? With women at the center, women as leaders, women unified, and also with the global South at the center. What is our version? What's our blueprint? And let's not just be visionary. Let's get our plans on paper. I've talked about Project 2025 in the United States. It obviously has impacts globally, but what's our blueprint? What's our counter push forward plan written down page by page, thousands of pages of how we're going to roll this out at the local level? And let's begin local. I'm not just talking national states, but really what's happening village by village, community by community, and how are we going to do this? I tell you, local, empower grassroots leadership. In the health sector, it's simple: empower community health workers, social workers, nurses, midwives. Doctors like me don't need extra power, I'm telling you. We're good. Nationally, let's reform the laws. We've heard a lot about this. I think this is where the real bit is. UN Women estimates 286 years before we close gender gaps in legal protections. Regionally, there's a lot of opportunity, support norm setting where there's culture and context similarities. Globally, I say, hey, let's it's okay if it's not happening in the UN right now, okay? It's all good. Globally, let's maintain our global relations, knowledge flow. Relationships should be nurtured beyond moments of crisis, fostering long-term trust, shared purpose, and mutual empowerment. And finally, make sure power and resources, direct funding, and power to frontline women's movements in the Global South to lead change on their own terms. Power is in the hands of women who are committed to women is our last hope for gender equality. Thank you.
Thank you so much, Roopa. I fully agree, diversity is strength, and voices from the Global South, women from the Global South, will be drivers of this global change that is so urgent and necessary. Unfortunately, we are running a little bit behind schedule, so I would ask you guys if you could please keep your interventions around 5 minutes. And next, we'll have Kemi from Feminista. She is the Chief Global Advocacy Officer there, to share your perspectives. Thank you.
I feel like I need to energize the room as well. Okay, since you all laughed, then that means we're good. All right. So it's an absolute pleasure to be here as I'm opening up my phone to get my speaking points. My name is Fadekemi Akinfaderin. Most people call me Kemi for short. And as Biruk rightly said, I lead the global advocacy work at Feminista. So today's conversation, I think it's one that is extremely close to my heart, but I think it's also something that I've been talking about for the past 2 weeks, as Dawn alluded to. And really want to appreciate the opportunity to be able to bring forth some things which I think both Dawn and Roopa have spoken a bit about. And so I 100% agree that we need to really look forward to center joy, to center collaboration in everything that we are doing right now, and not to give up hope. But I also want us to also realize and also focus on what we are actually dealing with in this moment in time, so that we can be strategic in terms of the actions that we need to take. So first of all, I want to kind of reflect a bit about the challenges that we're facing. And I really want to talk about how fundamental human rights are being under threat, and particularly the right to health, and particularly the right to sexual and reproductive health rights and justice. As we know, the right to health in SRHRJ is the cornerstone of human dignity. And it's essential for individuals, for communities, and for societies to thrive. But despite this, and despite this fact and this importance, we're actually seeing unprecedented challenges being thrown our way. The first I want to speak about is actually the assault on multilateralism and the assault on global health institutions as one of the core challenges that we're facing. As many of you already know, you can see the assault that the World Health Organization is currently facing, but not just only the World Health Organization, but also other UN agencies that are actually, some of them represented here. And this is coming in multiple facets, right? Through funding cuts, through pronouncements in executive board meetings, to withdrawal and actual political interference in what should be technical bodies that is driving the health and gender agenda. And we've also seen some of the frameworks in which we're working on being attacked. So frameworks, even, I mean, just this week as well, even though, yes, we did have a political declaration, but what is a political declaration without the recognition of sexual and reproductive health, rights, and justice? We've also seen attack on the UN Commission on Population and Development, which is happening in 2 weeks, and the increasing focus on ensuring that we don't have concrete agreements there to be able to prove or to make a case of its irrelevance when this was the agenda that gave us a human rights approach to population and development. It is not irrelevant. It is about everyday lived realities of women and the recognition that women have that bodily autonomy and the recognition that women and girls and gender diverse people have a right to health and a right to sexual and reproductive health. But we're also hearing even challenges or challenging to even the Sustainable Development Goals. And we heard that this week as well, in which that framework was called to question, a framework that we have all been working tirelessly on to be able to advance. So I think it's really important for us to think about this as an intentional, direct assault on multilateralism and the need for us to continue to support and to advance and to ensure that our multilateral system, yes, it does need some changes here and there, but the fundamental principle for which it was built on needs to remain. The second thing I wanted to talk about, and I think, you know, colleagues have already talked about the anti-rights and anti-gender movement and how they seek to roll back, you know, the hard-gained wins we've had, especially in areas of human rights and in areas of gender equality and right to health. But I think we need to also recognize the fact that these movements are using the same frameworks that they seek to dismantle to advance their own agenda. For example, the Geneva Consensus, which I have to say here, is not an internationally recognized instrument. It is not legally binding. It's just basically a group of friends that came together and said, this is what we think. So quite honestly, it's irrelevant. But they are using it as a rallying tool. And they're using it based on the principles of multilateralism. Like that's, you know, something that we need to think about. They do recognize the importance of working across regions and across movements to be able to have some sort of conversation and a guiding framework. I think, you know, the other one that I want us to think about, of course, which Roopa and I think also Dawn mentioned, is Protego. I don't know how many of you have looked at the Women's Optimal Health Framework and how similar it is to the global strategy on women, children's, and adolescent health. It's literally picking up the exact framework and trying to come up with a counter element that doesn't necessarily align with evidence. And we know that. And so I think we need to, and we've also seen, of course, them using many of the human rights instruments as well, in terms of also advancing their agenda. So we need to actually look at how they're doing this and really counter that and really allow governments that we work with on a day-to-day basis, who might not necessarily know this agenda and who might not necessarily have a good understanding of the content, to understand that this is not based on science. And this is not based on fact, and it's not based on lived reality either, and needs to be thrown out. And the third, and I anticipated and asked myself, should I speak to this? But I think it's really important for us to recognize the significant cuts we're seeing in official ODA assistance, right? And especially what its impact is on gender equality and health. And we're seeing with, for example, the shutdown of USAID, and not to be so centered on the US, but I do think we need to recognize that the United States was the largest funder of global health. And how this is actually setting very worrying trends that we're seeing across the board, from other governments getting their gender equality program to reduction in overseas development assistance in other countries. And I'm not mentioning specifics, but I'm sure you all know the different countries I'm referring to. But what is that impact having in terms of on the ground? And I think it's been flagged over and over again, the impact in terms of access to health services, the impact in terms of the HIV pandemic, the impact in terms of our ability to end gender-based violence across the board. And so while this can feel a little bit removed to the everyday US citizen that's sitting down in New York or across the United States, we're seeing significant repercussions on the ground and in the day-to-day lives of people. And it's something that we need to make sure that we are paying attention to, but we need to actually respond to concretely. So where do we go from here? What exactly is it that we need to do? And I definitely align with every single strategy that both Roopa and Dawn had mentioned earlier, so I don't need to repeat it again and save on time. But I think that one of the things that we need to do, first of all, is that we must defend our multilateral institutions, especially those that are responsible for global health and gender equality. We must support the UN overall. We must support WHO. We do know, for example, just earlier this January, that certain organizations have been convening with member states and encouraging them to withdraw from the WHO, and particularly targeting member states from the global south, with an overfocus on member states from Africa and from the Swana region. So what are we doing to be able to work with civil society, to work with governments in those countries, to allow them to be able to unpack and to see the deceit in that? And I was very happy to hear that there was a particular African government that raised and challenged this notion and idea and said, if you ask us to withdraw from WHO, who's going to help us when the next pandemic breaks out? So it warmed my heart very much so to hear about that. I think second, we need to continue to advance our work. We need to communicate the impact of the work we do around gender equality and its impact also on the right to health. We need to promote evidence-based policies and programs that center and advance human rights and the right to health and gender equality. We need to continue to support civil society organizations, feminist movements that are on the front line, that are doing that work. They have a unique and specific responsibility and positioning to be able to do that work at national level. I think we need to hold ground at the global level, and there are several organizations that are set up to do that, but we need to move resources, as Roopa said, to the ground, to those that are working on the front line, so that they can do the good work with their governments and make sure that their governments understand the issues, understand what is at stake, so that that way they can defend. We can do all we want to do here with the missions, but if we don't have capitals on the same page and actually understanding what this grand scheme is about, then we're going to lose the battle nationally, regionally, and at the multilateral level. And the final thing that I want to say is that around the issue of funding, we need to continue to work across the lines with our champions that are working and from the global north to make sure that we stop the bleed. We cannot, I've heard so many times this week that this is the end to ODA as we know it. Okay, if you say so, but the reality is that we need to have funding continue to support this work that we're doing. And I think responsibility sits in both places. We need to make sure that our governments in the global north are not reversing on the commitments they've made. You cannot have a right to health, you cannot have gender equality without the right to development. And ODA is part of that right to development, and we need to be able to continue to push forward and advocate for that. But on the other side, for those of us that are from the global south, we need to hold our governments accountable. They have to put their money where their mouth is. They need to, we cannot have our health systems completely dependent on international and foreign aid. We have to make sure that public resources and finances are actually dedicated to achieving gender equality and the right to health. But I understand that there are broader systems at play, the macroeconomics, that we need to also still uproot, transform to make that happen, from the issues of debt, from the issues of the, global economic and finance architecture. I recognize that, and we need to continue to advocate for that. So the issue of right to health, the issue of gender equality cannot be achieved if we're not engaging on the issues of economic justice and on the issues of climate justice. So we need to work on this interconnectedly and ensure that we're achieving that. And finally, I would just say the fact that, like, we need to basically continue this partnership. I don't think we can actually do this work, as Dawn had said, alone. No one single organization can advance on this work on its own. We need to make sure that we're continuing to build on the principles of multilateralism, the cross-movement engagement, the multi-stakeholder engagement, to make sure that we have different actors in the room that have their own specific niche and their specific entry points to be able to advance this in a unified way. We need to build bridges across different movements to be able to move this issue, because we all don't live single-issued lives. And we need to make sure that at the center of it is the issue of choice, the issue of bodily autonomy, but also the issue of movements at the center of it, advancing this work. And so that we can, quite honestly, make, I don't want to see 2030 come and we're in this position. Like, I really think that we have the opportunity now to not necessarily sit in the mess, but to rise above it and to be able to push forward, as Dawn said. So with that, thank you so much.
Thank you so much, Fadekemi. That was amazing. I think it's very important how you highlighted that the like-minded multilateralism is necessary. Focus on capacity building from both governments in the North and the South. And we have one more panelist today. Payal, please. The legal and advocacy representative from Physicians for Human Rights. Thank you.
Your Excellency, for being here today, and for my fantastic co-panelists for the rich discussion. I have to say I'm pausing after so much insight and reflection, and I think a lot of hope. I will say I maybe am coming with a little bit of a deeper dive into how we're seeing the current backlash playing out. But one reflection I take from listening to all of you, and hopefully I think will reflect in some of my remarks, is that there is a denial of shared humanity that's happening right now. What we're seeing globally is this idea that our borders and our militaries can protect us within these individual kind of arbitrary lines, that there isn't a need for multilateralism. There isn't a need for us to think about our health as a species, as humans, that we can foment violence, including gender-based violence, in one pocket of the world and not have it have impacts on other parts of the world. And there's this idea that borders and militaries will save us, when actually the dangerous conditions that we're creating in the global South, but all over the world, including here in the US, are going to cascade across borders. And I keep hearing about when the next pandemic comes. And, you know, at my organization, Physicians for Human Rights, where we're speaking to physicians and health workers daily about what they're seeing, the next pandemic is here, it's on its way, you know, and it's really not far off. And actually, even the pandemics that we have corrected, things like TB, you know, we are creating the situations right now for drug-resistant TB, for ongoing, for these pandemics to resurge and quickly. So maybe just to say, my co-panelists have shared many critical insights from the overall progress since Beijing. What we've seen since that moment includes significant positive global shifts. For example, over 50 countries have liberalized their abortion laws since 1994. But it also includes profound global backlash, manifested in many countries, but very visibly here in the US, where the past 3 years have brought the overturning of Roe v. Wade and increasing backlash to gender equality. Currently, In addition to this attack on human rights and gender equality, we are also seeing a full-scale dismantling of the global health system, catalyzed, but certainly compounded by other governments, catalyzed by the US government's funding cuts, but compounded by many other governments now stepping back. The intersection of these crises has created dangerous conditions that threaten our progress since Beijing by simultaneously disempowering women, girls, and individuals of marginalized gender identity, while also making healthcare increasingly less accessible or inaccessible altogether. Beyond this, in parts of the world that have already been facing other crises, including conflict and mass displacement, the situation is ripe for catastrophe. My organization, Physicians for Human Rights, has been working at the intersection of science, medicine, and the law to advocate for the right to health and dignity for individuals in situations of conflict and crisis, with a focus on attacks on health, sexual violence and conflict, reproductive justice, and freedom from torture. And I think picking up where Kemi left off, really looking at a concrete situation, I want to zoom in on a country where PHR works really closely, where over the past few months, we've seen these dangerous conditions really coming to a head. PHR has worked for well over a decade in Eastern Democratic Republic of the Congo, where we are currently seeing what we call a quadruple crisis of conflict and conflict-driven sexual gender-based violence, mass displacement, unchecked spread of infectious disease, and the US government funding freezes. Since 2023, 7 million people have been displaced by armed groups in Eastern DRC, especially in North and South Kivu. And there's been a surge of cases in sexual violence with 123,000 rapes reported. Research undertaken by PHR confirms that health workers have documented a massive influx of cases there in recent months. This year, the security situation in Eastern DRC has deteriorated even more due to the aggressive expansion of the M23 militia. In late January, M23 captured Goma, the capital of North Kivu, leading to over 3,000 deaths within days. By mid-February, the militia advanced into Bukavu and South Kivu. In the last 2 weeks of February alone, more than 895 cases of rape were reported to humanitarian actors in 2 weeks. This averages to more than 60 rapes per day. The occupation has resulted in widespread looting of hospitals, civilian casualties, and mass displacement, with M23 forcibly evacuating IDP camps and thousands fleeing to neighboring countries, further exacerbating the spread of infectious disease and cutting off communities from care. Last week, or 2 weeks ago now, M23 raided 2 hospitals in North Kivu, including a center that specializes in treating survivors of sexual violence. Rebels reportedly abducted 130 patients with gunshot wounds on the suspicion that these patients were Congolese army soldiers or members of the pro-government Wazalendo militia, yet another major violation of international humanitarian law. Compounding this crisis, the US government funding freeze imposed in January has impacted 70% of all humanitarian aid to DRC. And now hospitals are unable to provide many critical services, including services for SGBV survivors, as well as the ability to track or respond to infectious disease such as Mpox. For us at PHR, these orders caused an immediate pause in programming to document sexual violence and support child survivors in the Democratic Republic of the Congo. It's important to note that the impacts of these funding freezes were specifically compounded by the Trump administration's explicit refusal to consider sexual and reproductive health care, such as abortion care and contraception, as life-saving humanitarian assistance that would be subject to the waivers. Together, this quadruple crisis has both fomented conditions of grave health risks, including of gender-based violence and sexual and reproductive health harm, while also fundamentally undermining the system for delivery of essential sexual and reproductive health care, and specifically post-rape care. As Sophia Kaltorp, Chief of Humanitarian Action at UN Women, stated in her remarks on the situation of DRC, as the clashes unfold in a country that has endured prolonged instability, women and girls are bearing the brunt of both direct and indirect consequences, with their rights, safety, and dignity increasingly under threat. There is a critical need for this rethinking of the global system, for international action to provide a coordinated response to the health risks triggered by this quadruple crisis. Many governments have responded to this moment instead by turning inwards, by focusing on defense and military spending in an attempt to provide security. Yet it is a grave mistake to believe that allowing the rollbacks in rights and health that are occurring in countries like DRC will not have impacts across borders. These crises create the risk of spread of diseases such as Mpox and, as I noted earlier, drug-resistant TB. I just came back from Kenya where we were visiting a hospital that essentially let go its entire staff that was monitoring TB, including drug-resistant TB. I mean, these are really going to be quick consequences that we will see if there is not action. Further, the impunity and failure to respond to the uptick in gender-based violence in countries like DRC is also perpetuating the normalization of such violence, which itself is recognized as a global public health pandemic by the WHO. And that's something I really want us to sit with when we think about pandemics. So ultimately, what we're seeing is a human rights crisis intersecting with the public health crisis, with these devastating impacts on gender and other forms of equality, and an urgent need for us to be able to find ways to tell the stories of the human impacts, to be able to talk about the transnational and impacts of not acting. For us to show in some ways why multilateral institutions need to exist. The reason they need to exist is because our problems cannot be contained within borders. We have to find the ways for collaboration. So maybe just to say that's, I think, there's been a lot of recommendations here on how we do that. So I won't repeat that, but I think that is an essential part of the work ahead of us to talk about the ways in which borders don't contain these problems and that we need to tackle these as humans together. I wanted to note two other threats on gender equality and health that we've been following at PHR. The first, and I think we see this here in the US, but frankly has been happening in many other countries for a long time as well, is the attempt to convert the health system into a tool of law enforcement, including through the criminalization of abortion and policies opening the door to increased immigration enforcement in health facilities. This has been an ongoing issue, but really coming to a head here in the US. And this is causing significant impact on care that women and girls particularly need, but also intersectional, like barriers to populations that face intersectional discrimination, including, for example, immigrant girls and women. We're also seeing globally an increased attack on health in conflict and persistent impunity for these attacks. In 2023, the Safeguarding Health in Conflict Coalition documented 2,562 incidents of violence against or obstruction of healthcare facilities in conflict across 30 countries or regions within countries or territories, which is over 500 more than in 2022, which is a 25% increase. And preliminary numbers show that this number has increased even further in 2024. And this is something we haven't discussed here today. We're also seeing a deliberate attack on the healthcare system and on healthcare workers. And that's something that needs to be addressed. And what we're seeing is impunity for these attacks, and also the undermining of institutions like the International Criminal Court that are designed to ensure accountability for these kinds of violations. So this is another area where I think we need to think beyond just the global health funding. We also need to be thinking about accountability bodies. We need to be thinking about the attacks that are happening there and how they are engendering the kind of violence that we are trying to combat. And then finally, I'll end, since I know we've worked hard to keep the hope in this conversation, and it's hard in these moments. But what's giving us hope here at PHR and with our partners is really is the interest in solidarity across borders. Every conversation we have with health workers around the world is them wanting to stand up together, wanting to find ways to partner, wanting ways to raise the stories of the human impacts of these different shifts and why it is we need to come together collectively. We're also working on elevating the brave voices of those health workers and clinicians, community activists that want to be speaking out, that, for example, in the face of these funding cuts by the US government are willing to be vocal, even at potential risk to their own sustainability financially. We're also fighting over compliance. What we're seeing is a lot of fear right now. And that fear is something that sometimes leads to health workers, or especially hospitals, pushing forward very conservative policies, right? So for example, I heard somebody say here in New York that as the Trump administration came into power, their hospital administrators told them the only advice they gave clinicians was when the immigration officials come in, don't stand between them and the patient. And that was it, right? We have to push back at that. There are more rights, constitutional rights. There are other rights that are there. And so we've been working on creating tools and trainings to be able to give clinicians, health workers, hospital administrators, the frontline, the person working at the security desk in the hospital, the tools they need to be able to ask, hey, what kind of warrant is that? Do you have a judicial warrant, or is this not actually a warrant that lets you go talk to my patients? So, really providing those tools to push back and to really allow clinicians to do what they need to do to hold up their medical ethics and provide care. And then the last thing I'll say is we just had a convening of our student chapters of our organizations and medical students from across the country. And I will say this next generation is the other space that really gives me hope. I know, I think that the discussion at CSW with youth actors has been really inspiring. And I think this is another area where we really hope to be able to elevate, the youth voice and push back or push forward into this new world we're reimagining. Thank you.
Thank you, Payal, for your very clear focus. We'll now be moving into a Q&A portion. So could I please invite anyone who has a question? I can come over with the microphone. Yes.
Andrea Bassel. I serve as the founder for an institution called the Wawaba Institute, which is a womanist feminist theological institute. My question is around faith. I've heard a lot of things being said, but I don't believe that we're addressing the role of faith in the movement for global health and for the rights of women, gender equality. Most of these countries that I work in, faith behaves as a sanction for most of the people's lives. It is foundational to belief systems, to actions, to how matters are addressed, how decisions are made, policies, etc. And yet, I feel like the funding for faith organizations that are feminists and faith, justice and faith around women and girls and gender is severely dismissed. I mentioned I'm also a bishop in the Lord's Church, and I absolutely work for sexual and reproductive health, LGBT rights, etc. And I feel like when I stand up, I am a unicorn. Yes, there are pastors, bishops, churches, organizations that are fighting for LGBT rights, gender equity, etc. But we need funding and we need to partner with other organizations, because we can go in and say all we need to say, and then the people go to church on Sunday. And a lot of that is dismissed, or they go to mosque, or they go to temple, and a lot of that is dismissed. We are working to provide informed theological education that dismantles a lot of the misinformation and disinformation about faith, and we need partners. Thank you.
Thank you. Would anybody like to respond to this? Please don't.
I commend you. One of the deliberate strategies used by UNFPA is working directly with faith-based organization, faith leaders, and it's couched in our wider strategy of culture. Because we believe it is impossible to work on issues, let me back up and say, UNFPA has the sexiest mandate in the UN system, because we talk about sex, right? So we don't have a choice but to talk about sex. It's core to our mandate. But within that context, we're touching people's lives in the most intimate ways and spaces. And so we coach all of our work with faith-based organizations and faith leaders in the context of our wider culture space. It provides us then to address issues like youth engagement. It provides us the opportunity to look at the way that, the holy books are interpreted. Because a part of the challenge that we have is not so much what the Holy Quran or the Holy Bible says, it's the interpretation of those. So we do work in supporting organizations to better understand and communities to better understand how these holy texts are written and to understand the interpretations around them. There is an engagement that we do with faith leaders and faith organizations around advocacy. As you've rightly said, when all is said and done, if my pastor or my priest or my imam tells me otherwise, that's the direction I'm going in. So we spend a lot of time in terms of advocating for issues that are relevant to the work of the organization, recognizing that our faith leaders cannot go to the full extent that we may want them to. So, for example, they will never promote the use of condoms. And if that's the case, what are the other areas that we can work with them on, right? So we look for partners depending on the extent to which their mandates allow them to work, and we engage with them at that level. So I think, the work that you're doing, strong commendation to you for that. Within the UN system, there are organizations who are doing that as well. And I'm sure my panelists can speak to that. I'm happy to speak to you after to share my information, because I can put you in touch with different parts of because we have offices in over 150 countries. So wherever you are, I can tell you that we have a UNFPA office there who is likely doing the kind of work that you're doing as well. So kudos to you.
Thank you. Thank you, Don. Mhm.
I'll make mine very, very brief, but I'm extremely happy to meet you and to see you here and to hear your voice and the work that you are doing. As we say, you are doing the Lord's work. And so I just want to recognize you on that and to say that you are absolutely right. And there are a couple of organizations that are doing this work and that we've been partnering with. For example, the networks for Catholics for the Right to Decide, for example, is, an amazing network. And we do a lot of work as Force Feminista with them in the Latin America and Caribbean region. But there's also an alliance with Faith to Action or Faith in Action. I can't remember what the middle word is, but I would be happy in the ACT Alliance. I'd be happy if you are not connected to them already to be able to make those connections as well. But I do want to say that I'm so overjoyed because I also am seeing now also faith leaders really taking up space and providing us with alternative messaging, like alternative perspectives, so that we're not just consuming that one that constantly comes that is undermining gender equality, that's promoting fear and hate in all its forms. And even just, I don't know how many of you in terms of social media, I'm seeing more faith leaders actually take to these platforms and really educating the public of what the books say and what they don't say, and challenging some of those misinformation and disinformation that's being put out there. So I just want to echo Dawn as well in terms of saying thank you for doing the Lord's work. And I'll end it there.
So I think we only have time for one more comment. So Your Excellency, please, did you have one?
Good afternoon, and I really wanted to say something. It's just a remark to appreciate the panel and what you've said today, but also to say to the Special Rapporteur, thank you for inviting me. And every time you do these kind of, create these spaces, I'm always amazed, whether it's around nutrition and the right to health, or this particular one, I always learn something. And as a member state, walk away very encouraged. I mean, the fact that you brought to the center of this discussion how to defend multilateralism, that Payal, when you started there to say borders cannot contain these problems. I mean, that's why multilateralism exists, for us to come together collectively and see how we address this problem. And you brought it, Femi, this attack on multilateralism. And then connecting that to what Don just said about at the beginning, pushing forward. And I think part of that pushing forward, in the space that I am when we are negotiating some of these instruments, I wanted to say, let's push forward in the upcoming big meetings, the financing for development. How do we make sure that we push forward this particular issue, financing in the FFD4, where we'll be talking? And for my country, which is presiding over G20, we are definitely, again, Dr. T, you see how you bring this agenda. It's there, and making sure that it's again pushed forward in the G20 space. And then lastly, the other issue that I feel strongly about is in the conflict-affected areas. So again, I couldn't appreciate more to say in this space again, the focus on conflict-affected areas came up. DRC, South Sudan, Sudan. We now know what happened in the last 24 hours in Gaza. And you have been
I mean, you deal with this all the time. So I'm very happy that the women peace and security, but also the health issues too. You've raised those issues, and we always need to connect those dots. And I'm grateful to all of you. I think when we are in the halls of the UN, I always say we can't do all of this without we the people, and civil society truly represents we the people. So again, being part of the system and making sure that we can be able to take some of these forward through the processes that we have at the UN. So thank you very much. And Susan.